guys. Dr. Stephanie Porras. We've got Dr. Jonathan Cook here today doing a really awesome new podcast that we're about to drop. We are going to talk about some great things. And Dr. Cook just asked me an amazing question, and it was, what's the educational sort of journey that the patient goes on from the minute that they call the office to get a consultation to the minute they're about to go to the operating room? And I think for every surgeon, this looks really different. But I think the most important thing, and before even getting into the semantics of it, is to make sure that there is an education process, because not every surgeon, not every practice, has the same levels of education, the same interactions with the physician, with the nursing staff. So as a patient, it is very important that you come in educated and you leave feeling like you received education. What do you think, Jonathan?
Yeah, I think that most people who make their way into a plastic surgery practice come with a certain degree of information that they've acquired on their own, whether that's through Dr. Google or through Real Self, or more and more these days through Instagram and through social media, even TikTok. And so you have this set of expectations and ideas. Often that's the starting point. And so the conversation, at least for me, is kind of like, what are you expecting? What's your idea? And then how do I play a role in that?
Yeah, exactly. I think what I do is I see where their starting off point. How much do you know? Have you had other consultations before? Have you done any research? Have you gone to Dr. Google?
Yeah.
I love it. Some of my favorite patients, I literally just had one about 10 minutes ago, came in with a notebook
Wow.
and listed questions for me. And sometimes I think that physicians can get a little intimidated by that and honestly feel like they're maybe being judged or questions, or it can be accusatory. I happen to love it because I think that that means that the patient is ready to listen. They're ready to have a thoughtful discussion, write down furious notes. And for me, as somebody who, holds being a safe surgeon to a high standard, I want my patients to go to that operating room day one and then beyond in their recovery, knowing every little detail, all of that, the bad, the good, the ugly. And so I'm not scared of any of that stuff. What about you?
No, those are my favorite patients, the ones with the notebooks, with the questions. And even at like every successive visit leading up to and after surgery, I always make sure to ask patients, tell me, what are your questions? Where are you? Are you totally clear? Because I think that it's like our responsibility as plastic surgeons. We have to take the patient through that process and educate them. We always bring so much more experience and knowledge to the picture, and it can be scary. People don't even know what they don't know. So those people who have the notebooks, I mean, have you ever gotten where like they ask you like all these like off the wall like questions, and you're like, okay, so if I was actually in your shoes, this is what I would be asking, because that they want to soak everything up, but they sometimes are just a little bit off. But
Yeah,
those,
and I think sometimes there is something to be said about almost too much information.
yes,
And I think you and I have laughed about this in the past. I've had patients come to me for abdominoplasties, tummy tucks, and I'll tell them, "Oh, I do drainless tummy tucks sometimes, not all the time, but sometimes." And they'll say, "Well, I went and saw so and so, and they don't put a drain in, or they put a drain in. So why
yeah,
don't you put a drain in?" And
yeah,
and then
yeah.
it becomes almost like, did I do something wrong? Because you have this information or these preconceived notions of what the patient thinks it might be the standard of care, and so you're sort of having to undo some of the false information or something that might not be something that you do.
Right. So let me
Um,
ask you, do
yeah.
you have like a website, or do you have like a pamphlet, or do you have kind of like a map that you give the patients that steers them through what to expect?
Yeah, we do. So our consent process is essentially this. You come in for your consultation, and let's say you're here for a tummy tuck and I do my exam. I think you're a great candidate. So I'll come back into the room and I actually have a printout, and it's essentially a shorthand informed consent. This is not the informed consent they're signing, but really just a list of, bleeding, infection,
Yeah.
fluid collections, need for revisions, emergent surgeries, things like that. And we just go over it, and it's quick. And I've gone through the consent process. I've gone through sort of what are the most terrible things that can happen to them in a very short amount of time. It takes no time at all to go through this stuff. And again, they'll go through it again at their pre-op visit, but that allows, and I find once I go through all of that, a lot of their questions are answered. They're able to be like, oh, good. Well, I think you've answered all my questions now. Great. Perfect. And the conversation is not a difficult one, and it's an important one.
But I feel
Yeah.
like I get the same questions by patients, like almost like Groundhog Day on repeat. And I'm the kind of person like that doesn't annoy me. Like I like explaining the same thing that I know over and over again. But it's always like, um, when can I shower? When can I uh, start exercising again? How long do I have to wear a garment if it's
Right.
like a compression garment or a surgical bra involved? And I know we've been talking about this also offline, but
Stay
um,
tuned.
yeah, I think these sort of like decision points frame the individual approach that each of us takes to like helping our patients along the process of recovery.
Right. And ultimately, just like circling back, I think that's what makes this conversation so important is making sure that you are having a educated conversation with your surgeon. And anybody out there listening, Dr. Cook and I are both double board certified plastic and reconstructive surgeons, certified to the American Board of Plastic Surgery. We are held to a very high standard in that certification process. We have seen all kinds of trauma. We have gone through the ringer when it comes to our training and our experience. And so, both of us, I think, would stress the importance of making sure that you're seeing somebody that has those morals and values and will take the time with you that's needed to make sure that you're well taken care of.
100%. There should not be an oh shit moment or a that question catches me off guard. Like by the time you get to the point where Dr. Porras and I are in our training, in our practice, in our experience, we've heard and seen just about everything. There is no question that you can ask that's going to put us off balance. And if you find that you have that kind of halting or maybe like incompatibility with your surgeon, to me, that's a red flag. I know I have that sense when I talk to patients in consultation. If I'm not getting the feeling like they're going to do their part, and there absolutely is a two-way street on this for every surgery,
Right.
by the way. But if a patient isn't going to do their part, or if as a patient I feel like if the surgeon isn't going to do their part, then that's a sign you should probably not walk down that path.
Absolutely. It has to be a trusted experience, a true doctor patient relationship. I 100% agree. Something I'll always say is I'm not afraid to say no, and you've heard the mantra, I know, but a good surgeon knows when to not operate, right? And for whatever reason, we've all gotten those patients that come in and they say, well, I want this procedure. And then we say, you're not a candidate for that operation. And here's why. And, sometimes patients will get mad and you'll say, that's below the standard of care, or that's not a safe procedure for you, or I don't recommend that procedure because for whatever reason, for safety or whatever, or maybe the patient just isn't a good candidate because they have body dysmorphia, right?
Right, right.
And ultimately, sometimes it's a hard conversation to have, but I think all of us know that it's the right conversation to do.
I've never regretted not operating on somebody. I've never woken up in the middle of the night and been like, man, I would have done a great breast talk, great whatever. That kind of stuff doesn't keep me up at night. What's kept me up at night is when I've chosen to operate on somebody, and for whatever reason, the outcome hasn't been what the patient or I have wanted. And that's really, I think, another guiding factor since we're talking to patients about this critical interaction that happens when a human being comes to see another human being who's a plastic surgeon and they're trying to create something beautiful together. If you feel as though you're being rushed in that process and, oh yeah, no, we can definitely do that. Yeah, no problem. That'll be easy. Then that's another one of those like maybe just take a step back and you know remind yourself there's no such thing as an easy automatic surgery. I don't care. It could be like removing a mole. I've seen people's moles that have been taken off by whoever, infected or
Yeah.
I mean, things can always go wrong unless you have that, the willingness to look at that and explain that to someone. You're doing them a disservice.
Right. One of my favorite questions is, Doctor, is this surgery less risky than that surgery? If you're comparing two options. And I say, all surgery is risky. There's no such thing as a simple surgery, only a simple surgeon.
I like.
So I love these little cliches, but like, I truly agree with you. Like, but again, this is aesthetic surgery, and what's, I think, even more important is making sure all the T's are crossed and I's are dotted, because you're taking a perfectly healthy person and putting them through a procedure that could be potentially life altering and damaging and deadly.
Yeah.
So,
Yeah, yeah. The
we
concept
don't
of
take it
risk is
lightly.
different. It's different when you're entirely electing to do something. How much risk do you take on for something that you don't need?
Right. So, Dr. Cook, explain to me. I get this question a lot now, especially in today's day and age. What is the difference between a cosmetic surgeon and a plastic surgeon?
I think this is a extremely important question because there's so much recognition of these two terms when they're actually, and that people lump them together when they're actually very, very far apart. So a cosmetic surgeon, first of all, is anybody who practices surgery of a quote unquote cosmetic nature. They can call themselves a cosmetic surgeon, although there is a board of cosmetic surgery. It is not recognized by the National Board of Medical Examiners. It's not a recognized medical board in and of itself. So the standards, the rigorous review of credential, of experience that applies to literally every other specialty. And what specialties are those? I mean, think your pediatrician is held to a higher standard, your family practitioner, but of course, a true plastic surgeon or OB, your obstetrician gynecologist, a general surgeon, ear, nose, and throat, facial plastic surgeon. These professions are board certified professions because, again, there is a rigorous examination and training process to achieve credentialing. On the other hand, cosmetic surgeons can go through a pretty light 1 year course. I don't know the particulars because I didn't go through it because I wouldn't want to, but they come out the other end and they can call themselves a cosmetic surgeon.
Who
And
can be a cosmetic surgeon?
is it anybody? Do you
I
have to be?
think
You
it's
have to
anybody.
be an MD, though, right? Or no?
Yeah, no, I mean, I think they have to be an MD. Although, I find this so interesting because, obviously we're plastic surgeons. Before this we were general surgeons, and now we're both. But, just because you can do something, I feel like doesn't mean you should, right? Like, I technically couldn't deliver a baby, but I don't think that anybody wants me delivering their babies. I mean, I'm much better at doing lasers on your face.
Right. Things
So
things have gone wrong if you're delivering their baby.
right, and the other part of it is, okay, so if something does go wrong, do I have adequate experience and training of years of training to have seen, like what you said in the very beginning, we have seen almost everything, we've heard almost everything, and there is some serious value in that.
Yeah.
And to not be discounted, and we'll talk about discounts here in a minute, but
Yeah.
I'm going to deliver that baby, and if something happens, I'm not going to have the expertise to problem solve quickly and potentially save the mom or the baby's life. And so now we're seeing, and I'm not dogging OBGYNs and other people in the medical community, but there is a lot of crossover into aesthetics because it's a cash business. It's a $46 billion industry. And so a lot of people want a piece of that pie. And they want to get out of the insurance world or for whatever reasons. And so I think that patients need to be super careful when they're looking at these credentials. And I know it's confusing, but I think that's why you and I are here to try to educate them.
Let me try to spin this a little differently, if I may. I have a
Yeah.
friend in out of state. I'm going to try to be as vague as I possibly can. Who wanted to get a plastic surgical procedure done. They wanted a tummy tuck. And they did their research in their home state, in their hometown. And then they sent me names. And they were like, well, the best guy, the absolute best guy, this is the guy I think I'm going to go to. And they sent me the name, and it's a cosmetic surgeon. And the guy has a website and tons of befores and afters. And then you dig down deeper, and he did a year of surgical internship and then finished his training in emergency medicine. And then I guess did a cosmetic surgery fellowship. And this is, probably 15 years ago. Ever since then has been practicing essentially outwardly as a plastic surgeon.
Surgeon, yeah.
And so for that person, the plastic cosmetic, whatever, this cosmetic surgeon, let's call them what they are, this emergency room physician who has a year of cosmetic surgery training. What they have done is they've gone from a very narrow overlapping knowledge base, like how much you learn in emergency medicine that is applicable to the practice of aesthetic surgery. Okay, so that's a tiny slice. And then they've further put the blinders on. They've further narrowed that scope to the point where I bet you they're doing pretty much the same routine liposuction or lipo, tummy tuck. And I mean, if they're practicing, let's just say they're probably not killing people, hopefully. But this is
Right.
like this,
Sometimes.
they're standing on this narrow little ledge of knowledge and experience. And just like you said, God forbid what happens if something goes wrong.
Mm-hmm.
In comparison, the plastic surgeon, any plastic surgeon in this town that my friend lives in, whatever, has started from this massive experiential knowledge base, and training in plastic surgery requires you to have reconstructive experience. It requires, in our case, it requires you to have general surgical experience.
Pediatric and trauma and craniofacial and hand and
And that's
pelvic. I mean everything. I mean you're
exactly.
the master anatomist, so to speak.
And questions always come up. Sometimes it might be something as silly as like, oh, what's this lump here? Should we be doing lipo? Or,
Right.
or maybe it's like, I'll give you an example from the OR today. I was doing lipo and a breast reduction on a patient. She was prone, and we started to see that she had little welts on her back that she didn't have. And this is the kind of thing that, like, if you were seeing it for the first time, like, you'd be tempted, all right, well, she's having an allergic reaction to something. We should
Right.
probably, like, abort this procedure. But you know what? Like, we've been down this road before. We've operated in countless different settings, countless times. Uh, we we checked the patient's chart, and she did have a history of a sensitivity to the antibiotic, not a true allergy. It was documented. We gave her a little Benadryl, and the rash went away. Now, were we monitoring her airway at the time? Of course.
Right.
Safety involves having a backup plan. And you don't have the ability to have a backup plan when all you've seen is 300 lipo cases after your emergency room training.
Right. Exactly. So I agree, like buyer beware. I think that's the biggest thing that the board teaches us, once we go through the process is, we have to be advocates for the public and kind of, spread the message out there. Our job, first and foremost, is to keep the public safe. Even if you're not our patient, but it's to keep you safe. So, I think we've talked so much about being an informed consumer, the consenting process, knowing who to pick and why not to pick somebody over somebody else. And certainly I know you have a lot of experience of being in South Florida. You are very close to some of the dreaded Miami chop shops. And so you see a lot of these complications as well. So we'll just wrap it up here. And any final words for us, Dr. Cook?
I really, again, think that you're interviewing a surgeon, and it's a relationship that is so critically important. The amount of time that you spend beforehand should be adequate. I can't tell you in number of minutes, number of questions, but you should come away from that initial meeting with your surgeon feeling like that's my guy or that's my gal. And you should trust them. You should feel like you have the ability to ask questions, or if ask yourself if something came up and we were caught off guard, or there was some kind of an issue. What I want that person with me if something happened? And if the answer is yes, then great. That's the kind of relationship
So
that you need.
that's
So
a great point. That's an absolutely great point. Who do you want if the S is hitting the fan, right?
exactly.
So and do they have the knowledge base to take care of you? So well, thank you so much. This has been so fun.
My
We
sincere
hope,
pleasure, Steph. Thank you.
yeah. And so Dr. Cook, where can people find you? Um, if they're looking.
So I think the best place would be on Instagram. My Instagram handle is at Jonathan Cook MD on Instagram. We're working on launching something exciting at the end of this year, so stay tuned, but more information will be posted there.
And I can't wait. You have been such a good friend of mine for over 10 years. You guys, Dr. Cook and I go way back, and he's just an absolute source of education for me, and a really, really good friend. So thank you so much. I'm so happy we did this. I know there's more to come. And
Yes.
you guys, as always, you can find me on at Stiletto Surgeon on Instagram or at the website porousplasticsurgery.com. Check us out on iTunes.
Awesome.